What if, in your neighborhood, it wasn't safe to play outside, and there were no affordable organized sports? What if, in your schools, everywhere you went, it was easier and less expensive to eat candy, junk food, and fast food? That's the reality for over 1 million adolescents of color in California. And that's the reality that California Adolescent Nutrition and Fitness Program is working to change.
March is National Nutrition Month, and community leaders across the Bay Area are trying all kinds of ways to encourage better eating habits among preteens and teens, especially those in low-income and multi-ethnic areas. The cooking class is sponsored by CANFit, a nonprofit group in Berkeley that's targeting children in underserved areas. For many low-income children, this could be the healthiest meal they eat all week. Community leaders say for kids in poorer Bay Area neighborhoods, small corner markets are their easiest access to food. Soda is cheaper than a gallon of milk, and junk food and fast food are often their main meals.
Today, their idea of food is to pick it up at a fast food place or microwave it, and they don't know anything about how to cook or how to prepare a meal or even to think up a meal in terms of balance.
In our rush to prevent the spread of childhood obesity and save our young people from a lifetime of disease, we must create a healthy environment for them to eat and be active. Focusing on body weight can lead to poor self-esteem, disordered eating, and weight obsession. It also diverts us from the real issue, that most of our youth don't live in an environment where it is safe to be physically active, and where the healthiest foods are inexpensive and readily available. As a society, it is up to us to create an environment that all youth can thrive in. The California Adolescent Nutrition and Fitness Program, CANFit, is a statewide nonprofit organization working in one of the most challenging healthcare environments in recent memory. Budget shortfalls and an ever-increasing focus on national security are diverting attention away from the day-to-day nutrition and physical activity needs in low-income communities throughout California. Yet, for over a decade, CANFit has engaged low-income communities to improve nutrition and physical activity among California's African American, Latino, Asian Pacific Islander, and American Indian youth between the ages of 10 and 14, almost twice as likely to be obese as white youth. African American, American Indian, Pacific Islander, and Mexican American young people are disproportionately affected by the diseases associated with obesity. CANFit is leading the nation in finding ways to help adolescents of color make healthy choices in tough environments by working with them to change their communities, from raising money to distribute in community grants to training after-school providers to teach healthy eating and fitness. CANFit is changing communities to support healthy choices. From offering academic scholarships to educating parents on how to advocate for healthier food in their community.
It's a different way of thinking, because as I mentioned, the healthy foods are the most expensive foods, the fruits, the vegetables, the fresh fish, chicken, that type of thing. So I think they've been so tuned into some of the more starchy foods, the fast foods, that to change a mind that's already set is a little bit difficult. But once we started after a period of time, it kind of blends in, and then eventually they're thinking about the more nutritious food.
CANFit provides the skills, the ingenuity, and the sheer determination that ensures that despite the forces against them, adolescents from low-income ethnic communities will have the resources to lead healthy lifestyles. Established from the settlement of a lawsuit against a major breakfast cereal manufacturer for misrepresenting the nutritional value of its product, CANFit supports the development of healthy lifestyles for youth. Its goal is to prevent obesity and chronic disease by helping people adopt healthy habits while they're still young. Funded by foundations and donors, CANFit has grown into one of the most innovative and uncompromising nutrition education and community capacity building programs in the country. From the beginning, CANFit has emphasized community ownership of projects and insists that youth be involved in planning and evaluating each one. These programs don't just provide information to young people, they empower youth to be active participants. Involving adolescents in the decision-making process has resulted in such creative solutions as a hip-hop video promoting healthy eating and physical activity, a Cambodian recipe book, a nutrition and fitness curriculum for Korean language schools, and a fast food survival guidebook. CANFit changes lives and builds communities through community building, ethnic-specific social marketing, leadership development programs, and cutting-edge policy advocacy. Under the leadership of Arnell Hinkle, recipient of the prestigious Robert Wood Johnson Community Health Leader Award, CANFit has grown to become a nationally recognized leader in innovative, culturally competent approaches to obesity prevention through social, environmental, and personal change.